I'm Dr. Joe Esposito, and welcome to our podcast, For the Health of It. Remember to subscribe to our podcasts, and I'll help you naturally get well and stay well.
The information presented on this program is not intended to take the place of your personal physician's advice, and it is not intended to diagnose, treat, cure, or prevent any disease. Discuss this information with your own physician or healthcare provider to determine what is right for you.
Are you suffering needlessly? Dr. Joe can give you advice on how to naturally get well and stay well. Dr. Joe Esposito.
We're talking today about diabetes, insulin resistance, leptin resistance. I know if you don't know those words, you're going to get it today in the show. We started the show by saying if you're tired, fatigued, irritable, 1 in 4 chance that you're diabetic or pre-diabetic. Now that's crazy because 1 in 4 Americans are diabetic or pre-diabetic. So that's some scary stuff right there. So the first part of the show, we talked a lot about complex issues that happen in the body, how the hormones work, how the organs work, how the nervous system works. I don't want to repeat all that. So if you missed it, go to my website, drjoe.com, and we have over 1,000 hours of podcasts. So if you like listening to things, we have it as an audio podcast. If you like watching them, we have video podcasts. It's this show, it's other shows. If you have a podcast service, it's called For the Health of It. So you can look up For the Health of It, and you could binge listen to Dr. Joe or binge watch Dr. Joe all you want. And that's on For the Health of It on your podcast services or on my website, drjoe.com. So we started talking about fructose and how dangerous fructose is because it's different than glucose. Fructose has to be converted into glucose in order to be used by the body. And in the process, it creates uric acid, which gets in your joints and it hurts. And as a chiropractor, my team of doctors want to get you out of pain, not in pain. But uric acid prevents the body from properly producing nitric oxide. Nitric oxide opens up your blood vessels. It's a vasodilator. And that works for your brain, your arms, your legs, your reproductive organs. Everything needs good circulation. High blood pressure, what happens? The blood vessels constrict. And many times it's a nitric oxide issue. You have to stop putting the bad stuff into the body and then put the good stuff into the body. One of the supplements I have on my website, drjoe.com, is a nitric oxide support. Extremely popular. People love that supplement because it helps with their inflammation, because it increases circulation, but it helps with a lot of other functions as well. Nudge, nudge, wink, wink. So that supplement is on the website along with the Super Greens, the essential source. We're going to talk about probiotics, vitamin D, a lot of important things to deal with stabilizing blood sugar. So fructose, big problem. It's everywhere. I joke around my lectures sometimes. Where's fructose found? Everywhere. High fructose corn syrup. It's like, I think in every product known to man almost. The problem is that regular table sugar is 50% fructose and 50% glucose. The glucose is used as fuel. It's plain white table sugar. The fructose has to be converted. If you do high fructose corn syrup, that's 55% fructose. Only 5% more fructose, it causes a lot of damage. Here's the kicker. A while ago, there's health food out, agave nectar. You may still see it around. People think it's a health food. It's not. Just because it's sold in a health food store doesn't mean it's good for you. High fructose corn syrup, 55% fructose. Agave nectar, up to 85% fructose. And that's why it doesn't spike your blood sugar, because glucose spikes your blood sugar. That's the sugar in your blood. What happens with agave nectar is it has to go into the liver and be converted into glucose. So we can take agave, check our blood, and goes, it didn't spike my blood. This is awesome. But it's going to cause long-term damage later on. So stay away from that. Strongly advise you to stay away from that. And breads, cookies, cakes, donuts, pastas, a lot of fructose in there. So fructose does not stimulate leptin. So it effectively reduces the amount of leptin that goes into your brain, and so you don't feel full. Now this is, if you're fat, you're producing a lot of leptin anyway. But if you're normal size, this is how you get fat. Because fructose doesn't stimulate leptin production like other food does, and so you don't feel full. And that's why many times you eat sugary food. What do you want to do? You want to eat more sugary food. And so that's the problem with it. It interferes with the communication between leptin and the hypothalamus. Your brain senses starvation, and it prompts you to eat more. So that's why fructose actually makes you hungry. Fructose does not suppress ghrelin in your small intestine. Uh-oh, another big word. We had insulin, leptin, and ghrelin. Those are the big players in today's show. Ghrelin is produced in your small intestine, goes up to your hypothalamus and tells you that you're hungry. So in a normal person whose biology is working normally, you eat food, it goes into the stomach produces leptin, goes up to the hypothalamus, and your brain says you're full. You digest your food, and then the body says, wait a minute, I don't have enough nutrients. The small intestine releases ghrelin, and it goes to the hypothalamus and says, eat again. That's what makes you hungry. So fructose doesn't suppress ghrelin, and that's why when you eat sugar, not only do you not feel full, you actually feel more hungry. So it's a little complex reaction of what's happening with your hormones in your body, but that's where you have problems. Because if you're eating bad food, you eat more bad food. And I'm no different than you. I remember a while ago, I was up in New York, and I had Italian bread, and it was spectacular. Being Italian from New York, if you've never had Italian bread in New York, fresh baked, nothing like it in the world. So I had a piece, small piece, about the size of my hand, and I wanted more. Because as soon as I got that in my body stopped producing as much leptin, started producing more ghrelin. It was a sugar. And my brain said, all right, you're hungry, you're starving, you got to eat more food. And of course, the bread was a quick, easy fix, and it tastes good. So what did I want? More. So I had to stop. You have to consciously say, okay, the reason I'm hungry is that it's not that I don't have enough food. The reason I'm hungry is I just had this reaction occur in my body. Stop it. And then you're able to reboot your brain. All of this sets the stage for overindulgence and overweight, putting you on the path for diabetes. So everything's interconnected. And that's why in our offices, we work on what people say, well, you're a more holistic doctor. Yeah, I guess so. But I like to think of myself as a logical doctor. Let's try to get to the cause of your problem. Do you have pain? Do you have organ malfunction? Do you have acid reflux? Do you have digestive issues? Do you have diabetes? Let's put together a protocol specifically for you. And let's find out what we need to do it. Now, there's usually not a quick fix. I'm going to give it to you straight. Super Greens and Essential Source is the closest thing I can give you to a quick fix. There are 2 supplements. They're on my website, drjoe.com, and take a scoop of those every day each. And that's the closest thing I can give you to that's going to give you nutrients right away as a quick fix. But you really want to start working on getting the body healthy. And I know here in the station, everybody's wandering around saying, oh, not everybody. Some people are doing well. But I was just a guest on a show before this show. And the host was saying, Eric was saying, I got to lose weight. I've gotten to the point where enough is enough. I can't do this anymore. So why get to that point? Why not just maintain this healthy lifestyle forever? You're probably going to live longer. You're going to save a ton of money. You'll feel better. You'll stay young. Your love life will improve. You'll go to the bathroom better. You sleep better. There's no downside to staying healthy. I can't find one except for the fact that a lot of the bad food tastes good. You know, meatball sandwiches with provolone cheese on Italian bread, hey, that tastes pretty good. I'm not going to lie to you. But if you knew what happens to your body when you put these things in your body, you're able to make a more logical choice. Because what do? It's all human. Just this once. I'm going to treat myself. I had a rough day. I'm going to treat myself. And I'm going to go out and buy one of those fancy coffees that cost $10, and it has cream in it, and has sugar in it, it has whipped cream in it, and it's just so delicious. And you know what? It is. I'm not going to lie to you. But then that's 500, 600 calories. That's a whole meal right there, or more, sometimes more. And so the sugar goes through this whole process, and now you feel awful. So when you feel awful, what do? You want to feel good again. So what do? We can do things that'll stimulate our dopamine receptor sites in the brain. There's a bunch of them in the brain, but one of the main focuses is called the nucleus accumbens. And so you put the sugar in the body, it stimulates dopamine, you get high, you go, oh, I feel so good. And then you feel guilty that you ate this, 1,000-calorie coffee or whatever it was. And so you want to get high again. And there you're stuck in a thing. And I have a show, I'm going to do it in the next couple of weeks, on what is addiction. We're going to talk about what addiction is and what you need to do to reverse that process. So there's a lot of hidden sources of fructose. Like I said, high fructose corn syrup. So here's my rule. No more than 25 grams of fructose a day. Thinking, well, that's not a lot. You're right. I'm going to probably cut back on that and tell you no more than 15 grams of fructose a day, because I promise you, you're going to get 10 grams stuck somewhere, hiding. They put it in a lot of foods. Why? It tastes sweet. It stimulates the dopamine receptor sites. You like it. You want to eat more food. Food science. There are food chemists out there that want to find out how I can get you to eat more of these chips or more of these meatballs or more of this whatever. And so what can we put in there to make you eat more? Monosodium glutamate is a perfect example. Monosodium glutamate has something in it called glutamic acid. It's a chemical that stimulates the part of your tongue called the umami taste buds. Yes, that's a real word, umami. And the umami taste buds make you taste things savory. So when you put something that has glutamic acid in it, it tastes savory, it tastes better to you. And so what do you want to do? It's a flavor enhancer. You want to eat more. This is why you see MSG in so many different products. Thinking, why put MSG in a cracker? Why put MSG in a sauce? Because it stimulates your taste buds. You like it. You want to eat more of it, and the company's going to sell you more. And hey, I'm a capitalist. I think that's great. I'm happy. But you are my viewers, my patients, my friends. I want you to make better decisions. Nobody's forcing you to buy these things, and that's why you have to learn. And that's why, of course, you listen to these shows. So, diabetes drugs, I'm not saying don't take them, What I am saying is I want you to take steps to start preventing blood sugar issues. And if you start taking these steps, I'm going to talk about now, you should be amazed how quickly the body starts to heal. Number one, you got to get moving. You got to get exercise. Now, simple things. I personally don't like going to the gym. I get bored at the gym. So what do? I like to hike. I like to rollerblade. Haven't done that in about a year or two, but I really like rollerblading. When you do things, when I do my shows, stand up. So just by standing, I'm causing my body to balance. I'm causing muscles to fire and contract. That's an exercise. Go for a walk, park far away. Here at the studio, there's a lot of steps and a lot of levels in this studio. I park far away, walk up the stairs. Don't take the elevator. Clean your house. Go through that garage. Go through the attic. Go through all those papers. You probably got tax returns from 30 years ago. Get rid of them. You have to keep some stuff, so talk to your accountant and find out what you need to keep. Go get rid of them. Walk, clean, move, mop, sweep. Get the body moving. And what's going to happen is the cells then need what? Glucose as fuel. So they're going to start accepting more glucose into the body, and they're going to become less insulin resistant. You got to cut out the sugars. Now, when I say that, breads, cookies, cakes, donuts, pastas, wheat, barley, rye, grains, because grains convert into essentially sugar. Large reason for the failure of conventional diabetic treatment is that we don't get tough enough with the patients. Past 50 years, we've done some serious damage to folks because of flawed dietary recommendations. One of the things that drives me insane, artificial sweetener. I'm a diabetic. I can't eat sugar. I'm going to eat artificial sweetener. Guess what? It's worse. Because the artificial sweetener, let's say aspartame, breaks down to aspartic acid, phenylalanine, and methyl esters. Aspartic acid is an excitotoxin to the brain. It causes the brain to fire faster than it's supposed to, just like glutamic acid, monosodium glutamate. And what happens is the brain is firing faster, and you can actually get hungry. And that's why I've done shows before on studying that if people that are trying to lose weight, the more diet sodas they drink or diet foods they drink, the more weight they gain if it has artificial sweeteners in it. So folks, please, I'm on my knees begging you, give up the artificial sweeteners. That's sucralose, that's aspartame, acesulfame K. Please, I'm begging you, because that's the worst of the worst. I always say that of the 7 deadly sins, the worst things you can put in your body are artificial sweeteners. So cutting those out is important, but grains are largely responsible for a lot of the insulin resistance that we have. And people say, what's a good bread? I wish I had a good answer for you. There really isn't a good bread, because bread by definition is going to have grains in it that's going to give you problems. Now, there are low-carb breads that might be a better choice if you have to make some decisions, but I really want you to cut out the grains and see what happens. I think you'll be very happy with that. You want to eliminate all sugars and grains, even the healthy ones, like sprouted grain. Well, what about sprouted breads? I know you're thinking these questions, folks. I'm going to answer them for you before you send messages to my website, drjoe.com, because everybody says, I got a question, Dr. Joe. Sprouted grains, no. That's not a better choice. Bread, cereals, potatoes, corn. Think about this. What do we feed cows to make them fat, or pigs? Corn. So when you're eating corn, what do you think we get high fructose corn syrup from? So you really got to cut out the corn. That's a big one. And that's one of my guilty ones too. Because if I eat corn, I can almost feel the fat forming on my body. So if we're going to feed it to cows to make them fat, you should cut that out too. And here's the thing. Corn chips. I know you like your corn chips. I like my corn chips. It's the perfect storm. It's salty, it's fat, and it's sugar. Oh my gosh. What could be better? And what are the things that make us fat? Salty, fat, sugary things. Or salty things. Okay, because cookies, cakes, donuts. We take sugar, we add flour to it, more sugar, fry it, and then add sugar on top of it. Heaven. I get it. I used to make the donuts. I can't give a brand name, but I used to make the donuts. I was 14 years old. And I would walk to work every day and make the donuts. Probably shouldn't have been doing it back then. I don't know if that was legal or not. But I used to make the donuts. And after a while, you got burned out on it. You can't even do any more donuts, but some people don't. So I need you to cut those things out. Potatoes, rice. I know, sorry, I love potatoes, I love rice. Why? It stimulates the dopamine receptor sites in my brain, and I get high on it. So, got to start insulin likes to get into the cells, open them up, cells become resistant. So how can we get the cells less resistant? Stop giving it sugar. So we can do something called fasting. Now, you don't have to go on a 40-day fast, don't worry about it. But what I want you to consider is 12 hours a day, don't eat any food. So if you have dinner at 7 o'clock at night, don't eat again until 7 o'clock in the morning. That's a simple fast. That's fasting 101. Then I want you to cut out one meal a day, either breakfast or dinner. Do that maybe 2 or 3 days a week. And now what happens is this fasting is going to cause the cells to require more glucose and become less insulin resistant. So we talk about a nutritional approach. We talked about a chiropractic approach. If you miss that, if you have a pinched nerve going to an organ, the organ can't work. And so if you have a pinched nerve going to your pancreas, that can cause the pancreas to malfunction. So chiropractic, a lot of people think neck pain, back pain, headaches, sciatic pain. My team of doctors and I are really good at working with that. So if you have a pain, come see us. We'd love to be your doctors. Stop suffering needlessly. The biggest complaint I get it every day. I had 2 patients come in yesterday. Why didn't I do this sooner, Dr. Joe? I hear you say it on every show you do. I listen to your shows for 10 years, 20 years. I've been following you ever since you've been in practice and lecturing. Why did I wait so long? And after their treatments, they go, wow, this is amazing. So go to my website, drjoe.com. Make an appointment right now for you, your friends, your family, and your children. Please bring your children in. Children have spines just like you, and they need treatment. Because if they're healthy young, chances are they're going to be healthier when they get older. So go to my website, drjoe.com. In the Atlanta area, we have offices in Marietta, Duluth, and Stockbridge. And we would love to be your doctors. So book an appointment right online. You can call us if you have questions. If you've ever been in a car accident, ever. If the car was damaged, you were damaged. Come see us immediately. Don't waste time. Be careful. There's scam doctors. There's scam lawyers out there. Come see us. We'll give you a good treatment. So the website again, drjoe.com. I know this show's all over the world. If you want to do a phone consultation, we can't do chiropractic over the phone, but we can do nutrition. You can always set up a phone consultation or a Skype consultation as well. You got to get the right vitamin D in your body. Optimizing your vitamin D levels not only helps with type 2 diabetics, but can help eliminate the risk of type 1 diabetics if a woman is pregnant. There's a lot of research out there that babies that are born to mothers who don't have proper vitamin D levels are more prone to getting type 1 diabetes. So please keep your vitamin D levels perfect. On my website, drjoe.com, one of my supplements is Dr. Joe's vitamin D. We also had vitamin K2 to that as well for helping your bones. But it's vital that infants get their vitamin D levels normalized, either from the mother or as soon as they're born. So when you get a blood work done, I want you to get your vitamin D levels checked. And if it's low, I'm going to recommend very strongly you start taking vitamin D. We're talking about diabetes today, but it can help a lot of other things. There's 2 types of vitamin D, vitamin D2 and vitamin D3. Vitamin D3 is the type you want. Vitamin D2 is a synthetic version, doesn't work as well. So get the vitamin D3, you get it over the counter, it's no big deal. Go to my website, drjoe.com, we'll get it for you. You want to get out in the sun. If you're out in the sun for 20 minutes with your arms and legs and face exposed, you're going to get about 20,000 international units of vitamin D. So your body can process 20,000 international units of vitamin D a day. I'm asking you to take 5,000 international units. As long as you're consistent, you'll build up the vitamin D in your body. So make sure you're getting the vitamin D with the oral vitamin D. It's fine. It's on the website, drjoe.com. Time goes so quickly. I got so much to cover. Probiotics. Multiple studies have shown obese people have different intestinal bacteria than lean people. We know this. They've done bacterial transplants. It's a fancy word of saying fecal transplants. You can take the fecal matter out of a healthy person, a skinny person, and plant it into a fat person to try to build up the good bacteria in their colon. I think it's a little extreme. I think if you just take some good probiotics, like Dr. Joe's probiotics, it's on the website, that can help build up the bacteria in your colon. And stop eating the sugar, because sugar feeds the bad bacteria and the yeast, and that can kill off the good bacteria. So another reason we need to get those probiotics. Probiotics help build up your immune system. About 70 to 80% of your immune system is in your digestive system. And if you're killing off those bacteria every day, which we are, if we're eating traditional meats, what we call conventional meats or dairy products, they have a lot of antibiotics in them. Or actually have a little antibiotics in it, but it's long term. If using chlorinated water, I have a whole house water filter in my house. It's almost as tall as I am, and it filters every drop of my water. I use less soap. My hair comes out nicer. My clothes come out cleaner. But the thing is, I'm not getting chlorine into my body, because chlorine acts as an antibiotic. That's why we put it in pools, to kill the bacteria. If you're drinking chlorine, it's getting into your system, and it can kill off the good bacteria. And so if you take a hot shower, you're getting the equivalent of drinking 8 glasses of water, the chlorine amount, into your body. So you don't have to drink it to get it into your body. If you do baths, if you have toilets, of course, I'm assuming you have toilets in your house, chlorine is evaporating into your house. I think a really good investment is a good water filter. And if you need more information about that, you can contact our office. You got to optimize the gut flora. You can reseed your body by taking high-quality probiotics. eating fermented foods like sauerkraut, kimchi. But here's the thing, if you buy it commercially, chances are it's been pasteurized. So read the label. If it says pasteurized, it's killed a lot of the bacteria. Eating cabbage is excellent for you because cabbage naturally has probiotics in it. That's why we ferment it. I mean, think about that. You want to make sauerkraut. What do? You take cabbage, salt, cover it up, it ferments. Where did the bacteria come from to create the fermentation? It's in the cabbage. So cabbage is one of those amazing foods that you really want to add to your diet. It's loaded with fiber, loaded with probiotics. It has something called diindole methane. Diindole methane prevents testosterone from converting into estrogen, so it keeps your testosterone levels high. Again, we talked about the fiber levels. It has indole-3 carbanols, which can help prevent cancer. Cabbage, unbelievably superfood. You talk about superfood, cabbage is there. And here's the thing. You can go to the store if you're really lazy and buy chopped up cabbage. Yes, it should be organic, but let's get real here. Not everybody's going to eat organic. You should eat organic. But if you want to get really lazy, for $1.25, $1.50, you can buy a whole bag of coleslaw and then add a salad dressing to it. Add some apple cider vinegar to it to help your digestive system. You've got a superfood. I'd rather you get the organic cabbage and shred it yourself, but I'm trying to make it easy for you. Okay? And that's going to help build up those probiotics in your colon, which can help stabilize the blood sugar, which will help stabilize the fat, which will help stop producing leptin, which will help stop producing leptin resistance, which will stop you from eating so much sugar. Wow. How cool is that? A show I did the other day on probiotics is that a lot of doctors are now saying probiotics used properly can replace a lot of antidepressants. So people can actually come off their antidepressants by building up the bacteria in their colon, and it works really well with a lot of folks with post-traumatic stress disorder. How simple, easy, and cheap is that? Pretty cool stuff. Okay, so what can we do? Eat things to help stabilize your diabetes. I know I'm running out of time, so I got to kind of rush through this. Cinnamon, pretty familiar spice. Most people have it. It's been around forever. It's used bark of a tree ground up. And cinnamon is amazing because it helps stabilize your blood sugar. So what I want you to do is every day when you're taking your Super Greens and Essential Source, add a half a teaspoon or a teaspoon of cinnamon to it, and that'll help stabilize the blood sugar. Pretty amazing stuff, and it'll help with hunger too. So the cinnamon has chemicals in it. Let's see if I can get this one right. Hydroxycalcone, I think I'm saying it right, is a chemical in cinnamon that helps stabilize the blood sugars. Alpha-lipoic acid is very good for diabetics. Where do you get that from? Spinach, broccoli, Brussels sprouts, peas, potatoes. It can help people that are taking insulin now, can help stabilize the blood sugar. So it's alpha-lipoic acid. Again, you can take it as a supplement, but with a lot of these ingredients, you know where they're going to be found? Dr. Joe's Essential Source. I put these in there for a reason. I didn't just throw things together and say this is a supplement now. There's rationale behind all the ingredients. Fiber. A study found people who ate moderate carbs, high fiber diet lowered their blood sugar by about 21%. Why? Fiber pushes the food through the colon and you get a slow release of sugar. That's why if you eat an apple, it's different than drinking apple juice. The fiber is going to be so important. That's why things like broccoli and Brussels sprouts, low in sugar, loaded with fiber, loaded with other chemical nutrients as well, can push the food through the colon. And I remember years ago, I was a consultant for a TV station, not this one, different one, and they said, I reported a study that was in the journal, Diabetes Journal, and it said if you eat 68 to 72 grams of fiber a day, you can reduce or eliminate the need for most type 2 diabetic medications. This was 20 years ago. It's not new research. And endocrinologist called the station. He says, you know what you're talking about. And I said, here's the article from the Diabetic Journal. Why am I reading it and you're not? I said, here's your article. Let's discuss it on the air. Never heard from him again. So fiber is the key. We've known this for decades now. So you got to eat more fruits, vegetables, nuts, and seeds. Now, if you eat too many nuts, you can gain weight. So just be careful with that because people always say, what do you do about it? How do you gain weight is another question I get. Chromium, very important. Blackstrap molasses, grape juice or grapes. It's also in lemongrass, oats, dried garlic, peaches, broccoli, juniper. I know it's a weird thing. It's juniper. You're not going to eat that unless you're making gin, I guess. But these are things that can help it. There's also a supplement we have at our office called Gymnema. Now, if you call the office, you can get more information on that. It's not on my website. Gymnema is amazing. And what I tell people is take a tablet, chew it before you eat something sweet. It numbs the taste buds and nothing tastes sweet anymore, and that can help break your habits. You can take it internally, but Gymnema is pretty amazing for that as well. And if you take it 3 or 4 capsules a day, it stabilizes blood sugar. But when you have that craving, you got to chew a capsule, a tablet actually. Chew it. Doesn't taste good, but you'll have no sweet craving at all anymore. It's really kind of cool. So, folks, I'm almost out of time. If you want more information, go to my website, drjoe.com. We have over 1,000 hours of podcast there, including this show. Stop suffering. If you have neck pain, back pain, shoulder pain, come see us. Don't put it off till tomorrow. Go do it right now. Go to my website, drjoe.com. You can make an appointment right online in the Atlanta area. We have offices in Marietta, Duluth, and Stockbridge. If you've ever been in a car accident, you need to come see us, folks. If the car was damaged, you were damaged. I don't care what anybody else says. But the biggest complaint I get is, why didn't I do this sooner? Folks, I'm Dr. Joe Esposito. The website, drjoe.com. We'll catch you next time. Thanks for listening to For the Health of It. Remember to subscribe to this podcast, and I'll help you naturally get well and stay well. You can also listen to and call into my radio show live Sunday evenings from 7 to 9 Eastern Time on WSBRadio.com and on the WSB Radio app.